KaziRa presents How to cure vaginal infections without using medications. Welcome to the part 2 of our new video series How to cure vaginal infections without using medications. Here we will discussing 6 methods in this series. Please click the blue link in the description below to watch part 1. Before that, please make sure to subscribe our channel and click the bell to turn on notifications to catch our next upload of this series. Method 2. Trying douches to treat vaginal infections. Step 1. Know the risks of douching. Douching is not generally recommended, because the vagina naturally cleans itself. But it can be used sparingly when you have bacterial vaginosis. You should know, however, that there is a risk of pushing the bacteria into your cervix and uterus and risk pelvic inflammatory disease and other serious infections. Douching is actually believed by many physicians to increase the risk of bacterial vaginosis. Step 2. Try a store-bought douche. Douching is the procedure of washing or cleaning out the inside of the vagina with water or other mixtures of fluids. You can buy pre-packaged mixes for douching at most pharmacies and drug stores. These usually come in a bottle with a curved neck or a bag. Start by getting into the shower or bath. Most women find it easier to prop one leg on a surface like the edge of the tub. Be careful not to slip. Then, with one hand, spread the labia, the lips that are on either side of the vagina, and find the vaginal opening. Hold the bottle or bag in the other hand. Gently squirt the douche upward through the tube or nozzle into your vagina. The mixture will come back out through your vagina. Step 3. Mix apple cider vinegar with water for a douche. Apple cider vinegar is believed to restore the acidic pH of the vagina. It can be used with relative effectiveness to get rid of bacterial vaginosis. Get a douche kit from a drugstore. You will use the equipment that is included with the kit. Or, you can use an enema kit, which has the same equipment as a douche kit. Mix 2 tablespoons of apple cider vinegar with 1 cup of warm filtered water. Don't use white vinegar, as this is too acidic. Use the douche twice a day for 4 days and then daily until all symptoms disappear. Step 4. Try a douche made from hydrogen peroxide. Hydrogen peroxide has disinfectant properties, and it can also get rid of irritants that can cause bacterial vaginosis. Mix 3% hydrogen peroxide with an equal amount of warm distilled water and douche with this mixture. Use distilled water because the water should be sterile and bacteria-free. Use as a douche twice a day for 4 days and then daily until all symptoms disappear. Step 5. Use oregano essential oil and water as a douche. Use 2 to 3 drops of essential oregano oil in 8 ounces of distilled water. Repeat twice a day for 1 week. Repeat twice a day for 4 days and then daily until all symptoms disappear. For yeast infections, try douching with 2 to 3 drops of essential tea tree oil in 8 ounces of distilled water. Repeat twice a day for 1 week. Repeat twice a day for 4 days and then daily until all symptoms disappear. Never ingest tea tree oil. You can also apply 2 to 3 drops of the oil on a tampon and insert the tampon into your vagina. Leave it in for about 1 hour. Do not use essential oil treatments if you are pregnant, nursing, or expect to become pregnant in the immediate future. Method 3. Trying vaginal suppositories. Step 1. Try plain yogurt. It sounds messy, and it is messy. But inserting yogurt into your vagina is a way of repopulating the vagina with harmless bacteria that may be able to crowd out the parasite. However, there are no scientific studies that indicate this. Use plain yogurt in a 10 ml syringe. You can buy this syringe at your local pharmacy. Every night, fill the syringe with the plain yogurt and fill your vagina by inserting the syringe and depressing the plunger. Go to bed as usual, but wear a sanitary pad. The messiness comes in the morning when you get out of bed. You should also wear a thin pad during the day. Repeat every night until the symptoms disappear. You can also use a tampon coated with yogurt, but tampons without the applicator can be difficult and uncomfortable to insert. Step 2. Replenish good bacteria with a probiotic suppository. A probiotic will help replenish good bacteria in your body. Probiotic capsules can be expensive and can be found in most groceries and drugstores. Use gel cap suppositories, since hard suppositories may not be as effective. Buy a brand that has Bifidobacterium longum, Lactobacillus rhamnosus, Bifidobacterium infantis, Lactobacillus acidophilus, or Lactobacillus reuteri H188. There is not a lot of evidence showing if probiotics as a supplement or in yogurt are helpful in preventing trichomoniasis. Step 3. Use periodontal gel. Use Q-Recept periodontal gel and apply in and around the vagina. Q-Recept contains 0.5% cyclohexadiene, a disinfectant which has been shown to be effective in treating bacterial vaginosis. Step 4. Try a clove of garlic. A whole clove of peeled garlic can be inserted into the vagina and has been reported to be helpful in treating bacterial vaginosis. This is because the garlic contains allicin, which is a natural antibiotic that fights bacterial vaginosis. Peel a clove of garlic. Poke some holes in the garlic so that the allicin can be released. Insert the clove into your vagina. Replace the garlic every 4 hours for 7 days or until symptoms have disappeared. Step 5. Treat a yeast infection with a boric acid suppository. Boric acid can be irritating, so you shouldn't make your own suppository. Do not directly apply it to the vagina. Look for Vita-NICA yeast arrest, found in many health food stores. This product is specially formulated for vaginal yeast infections. Follow the manufacturer's instructions for proper usage. You must not be the recipient of oral sex while using boric acid because boric acid is poisonous to your partner. Method 4. Treating vaginal infections if home remedies aren't working. Step 1. Get an over-the-counter gel or cream. Most of the gels and creams for vaginal yeast infections that you can get over the counter are almost as effective as antifungal medications. Examples include Monistat and Gyne-Lotrimin. Use as directed. If you have recurrent infections, use for 7 days. Step 2. See your doctor about recurring or long-lasting vaginal infections. If you keep getting vaginal infections, or your infection won't go away, make an appointment to see your doctor. Recurrent yeast infections can be a sign of a more serious underlying disorder such as diabetes, cancer, or HIV/AIDS. If your symptoms don't clear up after 3 days, talk with your doctor about taking medication. You should also see your doctor if your symptoms return or worsen. Your doctor may prescribe an antifungal medication to suppress the infection. You will likely need to take this medication every week or month for 6 months to a year. Step 3. Take antibiotics for bacterial vaginosis and trichomoniasis. Treatment will depend on the type of infection, how extensive or severe it is and how long you have had the infection. Antibiotics are prescribed for bacterial vaginosis and for trichomoniasis, but they are not effective on yeast infections. Bacterial vaginosis is generally treated with either metronidazole or clindamycin. These are considered safe if you are pregnant. Male partners usually don't need treatment, but female partners should be informed and tested. Trichomoniasis is usually treated with a single dose of either metronidazole or tinidazole. These are considered safe if you are pregnant. Trichomoniasis is a sexually transmitted infection, so make sure your sexual partners are treated as well and wait for 7 days after treatment to have sex. Step 4. Treat stubborn vaginal yeast infections with an antifungal cream. Vaginal yeast infections can be treated with antifungal creams, ointments and vaginal suppositories. Examples of these treatments are butaconazole, ginazole 1, clotrimazole, gyne-lotrimin, miconazole, monostat 3, and terconazole, terazole 3. Your doctor can prescribe them or they are available, in weaker doses, over the counter at your pharmacy. Step 5. Treat a long-lasting yeast infection with fluconazole. Vaginal yeast infections can also be treated with a single oral dose of fluconazole, diflucan. Recurrent or more complicated yeast infections may be treated with higher doses of the medications or you may be asked to take them for a longer period of time. Most often, your partner won't need treatment. However, this may change if you experience recurrent infections. Step 6. Use caution if you are pregnant. Pregnant women can experience yeast infections, which should be cleared up before the baby is due. If you still have a yeast infection when the baby is born, it can pass to the baby, causing thrush. Check with your doctor about treating vaginal infections during this time. Hope you all enjoyed this video. If you like this video, please subscribe, share and leave a comment for improvement. Thanks for watching.